Welcome to the Epiwatch overview for clinic teams and clinicians. Epiwatch is an Apple Watch-based algorithm that detects tonic-clonic seizures. We are FDA cleared for ages 5 and up, clinically validated with a 6-site study, and provide continuous seizure monitoring, detection, and alerting with a false alarm rate of an extremely low 0.08 per 24 hours and a 98% seizure detection rate. The way that Epiwatch works is that once the account is set up on the phone, on the user's phone, which is paired with the watch, then Epiwatch can detect the tonic-clonic seizure, and it will alert the care network that you've set up to be notified either via text or phone call when a seizure happens. It also provides the GPS location of the individual, and that allows rapid action, the execution of a seizure action plan, delivery of rescue therapy, or other actions to keep that individual safe. Easily distributed via the App Store. Once they've downloaded from the App Store and set up an account, they will upload a prescription image. So we just need that picture of the prescription. It does not need to be sent to us. They upload that into the app. We also have the ability for the auto population of the seizure log. You can see on the right the calendar. So tonic-clonic seizures will be automatically logged, as will the hitting of this red help button, which is the alert button, that will be logged as an aura. The individual can go in and edit the seizures, change the seizure type if that was not categorized correctly, and add additional seizures and notes, and that will all be captured. And then you can see on this page, the summary of the seizure activity can be requested right on the individual's app as well. So they'll put the date range, and then a summary of the activity for that period will be provided. As part of the welcome package, there's an overview of the account setup. There's an explanation of the COPPA consent for users under 13 that is required that the legal guardian of the user complete the COPPA consent. And then we've also got the ability to provide support at troubleshooting@epiwatch.com. Once the prescription is uploaded, we would validate it on our side, and then they'll receive a notification that they are ready to move forward with the subscription and utilization of Epiwatch. Got a sample prescription form, primarily just to show individuals what is needed. We do need it to say Epiwatch seizure monitor as in terms of what is being prescribed. We need the individual being prescribed for, their name and their date of birth. And we also need the clinician name and NPI or provider number. Currently, this is available in the US only, and we can use the other category if you're using Epic or as your EHR. That works best to create the prescription form. We also suggest including and providing for patients a letter of medical necessity. This is very helpful for insurance coverage decisions. Please note this does not replace the prescription. These are two different documents and don't include exactly the same information. Once the account is set up and ready to go, hitting the blue monitor button is required to activate monitoring. You can also use the red help button for a manual alert. If you're just not feeling well, if you're having an aura, hitting that red help button will trigger an alert out to your care network. There's also an indication on the watch face that your detection is inactive, that your monitoring is not on. So you do need to hit that blue monitor button to start. And if you haven't done that, a notice will come up saying it is not on. So it is not automatically activated simply by having the app on the watch. Once you have turned it on, you get a message on top that monitoring is on and alerting is activated. You also have this ability when a seizure is detected, there will be a message on the watch face, and you have the option to say, I'm okay. So if this was not actually a seizure, if this was something that set off a false alarm, you can say, I'm okay, and no alerts will be sent to your care network. So this helps with fatiguing your network if this is not seizure activity. You can also, you see it will alert contacts in 4 seconds. We've defaulted the alert delay timing to 5 seconds. That can be adjusted by the user. if desired. You also have the option to pause monitoring. If you're doing something that you think may false alarm, then you can pause the monitoring by hitting the orange pause button. And then you have the ability to select how long you want that pause to last. You can see we've got several presets here. At the end of that time duration, the watch will return to monitoring automatically. To stop monitoring is a two-step process. So you slide the slider bar that says stop monitoring to the right, and that will bring up a screen that says, please confirm you want to end the session. And you have to hit stop session to end that session. The journaling and reporting has been simplified and at the request of users, and the ability to edit online on their phone, real time, has been added as well, so that you can get an accurate assessment of seizures. The tonic-clonic seizures and the aura button or help button will be automatically populated. But again, they have the ability to edit and add additional seizures, particularly other seizure types or whatever other information you want to include there. And then once you request that report, all of that information shows up in a nice timeline of seizure activity. We do have multiple clinical and advocacy partners. We are particularly grateful for the SUDEP prevention advocacy groups who have provided financial assistance for those who have submitted for insurance coverage and not received it and have need for financial support. The Danny Did Foundation, Josh Provides, the Chelsea Hutchinson Foundation, local Epilepsy Foundation, and Epilepsy Alliance organizations all have provided ways for individuals to obtain financial support for the subscription. And in the case of the Danny Did Foundation, they will also provide within budget limits an Apple Watch if needed, or the purchase of an Apple Watch. Currently, there are 3 FDA-cleared seizure detection wearables: Epiwatch, which is for tonic-clonic seizures ages 5 and up; Empatica's Epimonitor, which is tonic-clonic seizure detection ages 6 and up. They have built their own watch-like device. And then Nightwatch, which is ages 4 to 18, and primarily 4 to 16, but in most of those users, it is for nocturnal seizure detection because it is an armband worn and it detects motion during sleep. So it's not typically worn outside of the sleep hours. Just some highlights. So in addition to submitting for insurance, Epiwatch, because it is prescription and FDA cleared, is FSA and HSA eligible. We do work under a subscription-based model. Typically, that's $19.99 per month. For clinician-referred subscriptions, we do provide you with a code, EPWCLINREF, Epiwatch Clinician Reference. That's $11.99 for a month, and that is good for a year with that code. And then we do provide advocacy-driven technology education. We're happy to provide clinic-driven, other groups that are interested in education. We will provide that via Zoom. We can Zoom with office staff at your normal meeting times. So whatever way we are able to provide education and information, we're happy to work with you to do that. And then I've mentioned the financial assistance programs that are available, and we are very, very happy that those organizations have partnered with us to be able to do that. Let's look at a few cases where Epiwatch is being used and what the impact is. Maria is 28, living with epilepsy, has tonic-clonic seizures and focal to bilateral tonic-clonic, both of which are detected by Epiwatch. Works at a store. Epiwatch alerts for tonic-clonic seizures, which is helpful if she's at work and her family is at home. She also utilizes the help button when experiencing an aura. She's also implanted with an RNS, a responsive neurostimulator, and that has helped to reduce seizure activity, but is not optimized to reduce all seizure activity. So in her last visit with her clinician, they looked at, she had requested that we pull the data for review. So they looked at actually what was happening when she would hit the red aura button or the red help button, so was feeling something, and then when the seizure actually broke through and a tonic-clonic seizure was detected. That was compared with the ECOG data from the RNS to look at what was happening from a stimulation perspective. And as a result, they lengthened the stimulation timing to try to adjust to optimize to prevent that tonic-clonic seizure from breaking through. So this is a case where it was used, good objective information was used to optimize therapy. James is a 16-year-old who's living with epilepsy. He has both tonic-clonic and focal seizures. He's an active high school student, has a good group of friends. Epiwatch works well for detecting and alerting for tonic-clonic seizures, does not work to alert for focal seizures, but his fellow students have figured out that if they hit the red help button, that will set off the manual alert and bring the teachers with his, in his case, he uses a nasal rescue therapy. He also previously used a detection device where he could easily set off the false alarm by shaking his arm. That does not work for Epiwatch. And so he's taken on as a personal mission to find ways to set off Epiwatch and report back to us, which is helpful for algorithm refinement and further training. So far, jumping on a trampoline while dribbling a basketball and taking the family walk behind lawnmower across a bumpy dirt road he's been successful, but has not been able to trigger a false alarm in multiple other ways. So where he's tried to do that. So we admire his tenacity in trying to work and help us understand how Epiwatch may interpret some of these activities that he's trying to get it to false alarm to. So love the engagement and his dedication. Chase is a child who now sleeps in a room independent from his parents. He has tonic-clonic seizures. They didn't believe he had nocturnal seizures. The watch alarmed in the night, and they didn't notice anything when they came into the room, although he seemed a little out of it. So they sent a note to our support team saying, we don't think he has nocturnal seizures, but could you look at this and determine if it was a false alarm? When the support team actually looked at the data in review, it does really appear that this was a tonic-clonic seizure. It's consistent with the pattern, the activity, the heart rate. And so he likely does have nocturnal seizures, and this is something that would have previously gone undetected and also unreported. So this is valuable both for his parents to know, as well as his clinician in making care decisions. And then finally, Rose, who has tonic-clonic seizures, sleeps in a room independent from her family and utilizes a rescue therapy. Now, the family, when they deliver the rescue therapy, has a bit of anxiety around it, wants to make sure it's done just right. They were told to administer the therapy at about 2 minutes, and they wait precisely for 2 minutes to administer. Previously, they said they were trying to start a timer when the seizure started. There's a lot going on during a seizure, so you can imagine that might have been difficult to do. So now they just use the timer that is on the Epiwatch, which will tell you the time since the event detection. And when that hits 2 minutes, then they administer the rescue therapy. So this has helped ease their anxiety around therapy delivery. We also provide these flyers. So on this particular one, on the front side is the information about Epiwatch, that detect the seizure, alert the care network, and act. And then on the back is the seizure action plan. So in discussions with individuals, we realize that not everyone has a seizure action plan or is familiar. So this will allow them to take a look at what they should set up, how they can set this up and share it with individuals that they work with or they go to school with, so that people are prepared when they have a seizure. We can also provide this in more detail, but this is a poster that was presented at American Epilepsy Society in December 2024, summarizing our clinical study, which was 242 subjects across 6 epilepsy monitoring units, and then a high sensitivity, 98% of seizures were detected, tonic-clonic seizures, and then a very low false alarm rate, 0.08 per 24 hours. If you have additional questions, you can always find us at admin@epiwatch.com. For troubleshooting, you can reach us at troubleshooting@epiwatch.com. We're happy to take your questions, your comments, and your feedback. Thanks for joining.